And maybe Mike would like to add on this. So WHO has issued guidance on testing strategies for how to use testing as part of the control strategy for the COVID-19 pandemic. We've outlined guidance for countries that are at different stages of their outbreak, whether they have a small number of cases or a large number of cases. And it's up to the countries to adapt that testing strategy to the needs of the country, depending on the capacities that they have, depending on the intensity of transmission that they have. What we've outlined are strategies to actively find cases. And so we have recommendations to test suspect cases. And in situations where it is feasible and is possible, to expand testing where necessary, to really look for the cases so that they could be isolated and that contact tracing can ensue. So there are different types of guidance that WHO has put out on this, including the normal laboratory guidance that we have. We have additional considerations for different prioritization of testing depending on your intensity of transmission. And we have investigation guidance. So for the specific example of cluster investigations, testing may need to be expanded to look for individuals who are on the more mild end of the spectrum or who may indeed be asymptomatic. But again, what's really important is that testing is used as an opportunity to find active cases so that they can be isolated and so that contact tracing can also take place where you identify all of the contacts of a known case and that they can be quarantined. And this is really fundamental to breaking chains of transmission.
To add, Mike, can you go ahead?
No, I think Maria has covered it extremely well. I think the primary purpose of testing is to confirm whether a suspect case has the disease or not, and many countries are focused on that. And as Maria said, that allows us then to begin the process of contact tracing to those confirmed cases. So it's really important that testing turnaround. It's not necessarily how many tests you do. It is important that the rate of testing is kept high, but it's also the speed at which those tests are turned around. Getting results back a week or 10 days after the test is done really it causes a difficulty because then you can't do effective contact tracing. So the most important part of a testing strategy is to decide who you're going to test, focusing on those suspect cases, and then getting those people tested and getting those results back as quickly as possible and initiating the public health actions, either in terms of isolating or quarantining contacts, carrying out cluster investigations. And as Maria said, in those situations, particularly where there have been a cluster of cases, broader testing of other people who may have been exposed and who may be carrying the disease, may have it asymptomatically or be pre-symptomatic, then there is a rationale for testing those people because you will tend to get a higher return. But broad-based, population-based testing at this point in most countries is not really that useful. It absorbs huge amounts of resources, and you have to have a huge capacity to do testing in order to do that. So we need to focus on testing the right individuals. We need to focus on maximising the testing within clusters, and we need to focus on the quality of that testing and the speed of turnaround of that testing. And then what happens next? Testing is one thing. Testing is one part of the process. It's what happens when you test, how quick the result comes, how quick the investigation happens, and how quickly you can intervene to shut down chains of transmission. Sometimes we get too focused in on the act of testing itself. It's a vital part of a very important chain of activities that helps us to suppress this virus.
Thank you very much, Dr. Van Kerkhove and Dr. Ryan. The next question goes to Josephine Ma from the South China Morning Post in Hong Kong.